Including out-of-pocket healthcare costs in your retirement planning is really crucial. We find that a lot of people, they'll plan for a trip, they'll plan to spoil their grandchildren, they'll plan for saving for a hobby, but they don't factor in these out-of-pocket healthcare costs. And that is a huge mistake for folks. Surveys after surveys have showed that for a retired couple, their out-of-pocket healthcare costs could reach $200,000, depending on their medical situation. So if you don't save for those costs, that's going to put a big dent in your nest egg, and it's going to cut into that kind of happy, fun, healthy retirement that you're looking for. It is never too late to start, and we're fond of saying here, plan, 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 save, save, save. We recommend to people that they start saving by the time they're 35, but even if they haven't, if they can develop a plan now and stick to it, it will make a big difference and they won't regret it. We have this fabulous online tool. It is free of charge. You don't need to be an AARP member to use it. We call it the Healthcare Costs Calculator. And what it does is you put in some basic information about yourself, your age, your height, where you live, things like that. And then it helps analyze those factors along with a history of healthcare costs, and it tells you what your costs in retirement might be, out-of-pocket costs. But it also goes one step further, and it helps you create an action plan, not only for saving, but also for doing some lifestyle changes that might help you reduce those costs. You know, for example, the two that always come to mind for folks are smoking and if you're overweight. Now, if you can stop smoking and you can lose weight, that might help reduce some of your costs in retirement. So again, it tells you how to save, how much you need to save, and maybe help you reduce some of those costs. So it's a great tool. It is located on aarp.org/HCCC for Healthcare Cost Calculator. Plan, plan, plan. Save, save, save. I know I sound like a broken record, but I can't emphasize that enough. You need to plan for these costs, and then you need to actually put some money away towards these costs. You know, look at your family history, see what kind of medical condition your parents perhaps had, or your aunts and uncles later in life. That might give you an indication of what your life may look like, your medical situation, and then get a plan, stick to it, and save. Even if it's just a small amount, it will add up and it will make a big difference in your retirement years. We have a suite of tools in addition to the Healthcare Cost Calculator, a budget tool, a Social Security tool. You can find them all on aarp.org/readyforretirement. That's aarp.org, ready for retirement, all one word. Please check it out.